I guess she's going to tell us something when it's time to start. I have 6 o'clock.
She says begin.
Good evening. Welcome to this Facebook Live event brought to you by the African American Community Partnership Group, AACPG. I am Mary Harris, your moderator for today's presentation. The AACPG is a community needs-driven effort working collectively to help the African American community work through and overcome COVID-19 and health disparities. We do this by providing tools of education and self-care. The AACPG works with other community organizations to provide a united effort of advocacy, education, and social justice. You can follow us at facebook.com/AACPG Lake County or Instagram at AACPG Lake County. I invite you to add your comments to the chat box, click like, and share this presentation with your Facebook, Instagram friends, or you can even host a watch party. Today's session will be a panel discussion on COVID-19 with the nurses of Chi Eta Phi sorority, Nu Phi chapter. We will have a Q&A session, so be sure to leave your questions in the comments. At this time, I would like to introduce our nursing panel presenters. Starting with myself, I am a retired registered nurse with 20 years of nursing experience and 20 years of administrative experience as a quality improvement coordinator manager, and 5 years of academia experience as adjunct faculty for the College of Lake County, teaching the clinical and theory for the Certified Nursing Assistant program. I'm a member of the Chi Eta Phi Nurses Sorority, Nu Phi chapter, a member of the Delta Sigma Theta Sorority, Waukegan Alumni chapter, and co-founder member of the North Shore chapter of the National Black Nurses Association. So for this discussion, we have 4 other panel members, and I will give a brief introduction before each panel member covers their area. We will be going over an overview of COVID-19. We'll be sharing a nurse's experience as a patient with COVID-19. We'll cover treatment modalities, and we'll cover a nurse manager's perspective from the front line perspective. And we'll also cover academic prep and nursing students and how they're getting their training now. So next, our first presenter will be Marjorie Alexander. She's an MBA, BSN, RN, and a certified case manager. Marjorie is a native of Davenport, Iowa. She attended Marycrest College, where she earned a Bachelor of Science in Nursing and was commissioned in the United States Navy in 1989. She served 27 years as a Navy nurse and retired at the rank of commander. Marjorie holds a Master's of Business Administration from National University, San Diego, California, and is a certified case manager. Her nursing experience includes pediatrics, ambulatory care, and case management. Marjorie has been an active member of Chi Eta Phi sorority, Nu Phi chapter since 2014. She currently works in a primary care clinic, providing care and support for those in the military, their families, and retirees and veterans. So at this time, Marjorie will present to you an overview of COVID-19.
Good evening, everyone, and thank you, Mary, for that introduction. My name, again, is Marjorie Alexander Coffey. I will be sharing with you a brief overview of coronavirus COVID-19. So what is COVID-19, coronavirus? I think we all have heard or possibly know someone who has been infected or affected by this disease that has taken over our lives since the beginning of this year. COVID-19 is a disease caused by the new coronavirus that emerged out of China in December of 2019. Coronavirus is a respiratory illness caused by a virus called severe acute respiratory syndrome, SARS-CoV-2, which quickly spread to many countries around the world, causing a worldwide pandemic. As of December 7th, 2020, across the globe, 1,537,975 deaths have been attributed to COVID-19. However, 43,191,968 people have recovered from this illness. The United States is leading the way with the most deaths of any single country, with 282,345 deaths and 15.5 million cases. This information comes from the coronavirus COVID-19 global case map developed by Johns Hopkins University. So COVID-19 affects different people in different ways. Affected people have had a wide range of symptoms reported, from mild or no symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus, with 5 days being the average of the symptoms to show. Symptoms may include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. More emergent warning signs of COVID-19 are trouble breathing, persistent pain or pressure in the chest, new confusion, bluish lips or face, and may require a call to 911 or hospitalization. It is important to recognize these symptoms to help protect you and others, to get help and to help stop the spread. It is also important to recognize these symptoms if you or your loved one have underlying medical conditions, such as, but not limited to, diabetes or asthma. COVID-19 is spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can be inhaled when you do not protect yourself. Spread is more likely when people are in close contact with one another within 6 feet. COVID-19 also can be spread by touching surfaces or objects that have the virus on it, and then touching your mouth or face or eyes. Coronavirus is confirmed or diagnosed only with a lab test, which most people with mild symptoms may not get tested, but simply isolate themselves and to treat the symptoms. Up until recently, there has not been a vaccine to protect against the COVID-19. Approval for the coronavirus vaccine is on our doorsteps, ready to be rolled out soon. In fact, the UK has started their coronavirus vaccination program early this week, and Canada is starting their program by the end of this week. So how do we protect ourselves until our vaccine is available and is approved for use in the United States? We practice prevention that involves frequent hand washing for 20 minutes, coughing into your elbow, staying at home when you're sick, wearing face masks and coverings in public, and practice physical distancing at least 6 feet apart. Now, wearing a face mask in public helps prevent the spread of COVID-19, but only if worn properly and covering both your nose and mouth. I will come back later and discuss with you some treatment modalities.
Thank you so much, Marjorie, for that information. Our next presenter will be Carol Stewart. Carol is a retired nurse with 16 years in the Army Corps 801st General Hospital of Fort Sheridan, Illinois. She has 24 years at the VA Hospital, North Chicago, in psych, community health, alcohol rehab, and geriatrics. She also worked at the Lake County Health Department Addictions Treatment Program and retired in 2015 from the College of Lake County adjunct faculty teaching clinical and theory the Certified Nursing Assistant Program, including the same for the Tech Campus CNA program. Carol is a graduate of College of Lake County ADN program and Alverno College with a BSN program. Carol?
Thank you, Mary. I've been in the Army 22 years, and I am retired. I am retired from the Army Nurse Corps. Now, even though I didn't have oxygen and I wasn't on a vent, I was very, very, very sick at Vista Hospital with COVID. Now, I'm an avid bowler who bowls twice a week to get my exercise for my diabetes, and I'm an active senior citizen. Now, looking back, I was in a bowling tournament on Saturday, the 24th of October this year. And as an 80-year-old and a retired nurse, I knew the importance of following the rules set forth by the Center of Disease Control as regarding COVID. Now, we all at that tournament wore our masks and maintained the recommended distance. We used hand sanitizer, we drank water, and I took every precaution to be safe. My symptoms started with numbness and tingling of both arms, a runny nose, which I thought was an allergy, and a dry cough in the morning. Then on Tuesday, November 3rd, which was voting day, I experienced extreme weakness, dizziness, confusion, shortness of breath, chills, and fever. And while voting, I was so weak, they had to get me a chair to sit down. By Thursday, my body aches and weakness were so profound and painful, I felt like crying. I began to urinate frequently. I couldn't smell or taste, and I was so nauseated continuously. So I hadn't eaten in about 2 days. That Thursday morning, my daughter came over after working the night shift, and I told her, I'm going to the hospital. And so she took me. And I want to add that my eyes were affected as well. I had blurred vision. I told her I felt like I was dying and was in a lot of pain. I got to the emergency room with a temperature of 100.4 and the symptoms that I mentioned, but they wanted to send me home. My daughter insisted that they take a COVID test, which was positive. And my diagnosis was also adult dehydration. So they did take me into the hospital, and I was treated with IV fluids with saline for 2 days. And I got 1 Tylenol, 500 milligrams for the body aches and pain. Now, even though I was eating very little due to the nausea, I was sent home after 2 days to continue my recovery. The Lake County Health Department called me, their Lake County Health Department COVID-19 resource team called me and asked me, were there any resources that I needed? And I told them that I needed food. I couldn't prepare food for myself, and I lived by myself, and I was still very, very fatigued. So they saw to it that I got food twice a week on Tuesday and Thursday from a restaurant in Highland Park that only had to be heated. But first of all, Mary Reese, our moderator, she made me a dinner. She cooked me a dinner, which was just wonderful. And I could eat her dinner, but everybody else sent me soup and I could not eat the soup. Um, the COVID team also gave me instructions on what to do. And one of the things they said was to get some ginger root and cut it off and make a tea. And that would help the nausea. And then I could eat better. So day by day, I got a little better and a little better and a little better and a little better until I'm all well now. And I received my COVID results from the test that I took after my quarantine, and it's negative. So that's my story.
Thank you so much, Carol, for that. And we are so happy that you're on the mend and doing well now.
Yes.
It's great. We're going to go back to Marjorie now. She's going to give us some treatment modalities. Marjorie.
All right. Thank you. So you have some mild symptoms. So you have cough, fever, possible some other symptoms. You may have COVID, especially if you've been in an environment where you may have been exposed. The sure way to find out whether you have COVID is to be tested. But many people who have mild symptoms, like the ones I just described, do not go and get tested. What they do is they recover at home and isolate. If you have more severe symptoms, such as the confusion that Carol spoke about, difficulty breathing, chest pressure, chest pain, these require hospitalization and a call to 911. But as I spoke earlier, coronavirus is a virus, which there are many different viruses. And most viral infections, the treatment can only help symptoms while you wait for your immune system to fight off the virus. Antibiotics do not work on viral infections. However, vaccines can help prevent getting many viral diseases. Hence the reason why the vaccine is coming on board soon. People who become sick with COVID are treated with supportive measures, those that relieve symptoms. More severe cases, again, require hospitalization, and they may receive research drugs and/or treatment modalities along with supplemental oxygen or even ventilative care. So the asymptomatic person with known exposure, what they do is they isolate. So they isolate until a few days until they are able to go back to work or back in their settings, but usually 14 days because you don't, you've been exposed. Mild illnesses, signs and symptoms such as the fever, cough, sore throat, you monitor those symptoms and manage those symptoms until clinical recovery is achieved. Moderate illness, that includes you have some decreased oxygenation, evidence of low respiratory disease such as pneumonia. The pneumonia can be treated with antibiotics, and then you're going to be evaluated daily to see how you're doing. And when the pneumonia is cleared up, the antibiotics are discontinued, and you continue to monitor that you don't have any more symptoms. Severe illnesses, the oxygen levels are below what we call 94% oxygen level. Oxygen therapy with possible low flow oxygen and even ventilative care. That again is going to be hospitalization. And critical illness includes acute respiratory distress, septic shock, cardiac dysfunction. These patients require intensive care unit care to treat both the COVID-19 and the medical condition. So it ends up being like your grandmother said. Like she used to tell us, you need to take it easy. People don't want to do that, but you need to take it easy. Get lots of rest, plenty of fluids. Like Carol said, hydration, hydration, hydration. And then taking those over-counter medications such as the Tylenols, naproxen, which could be Aleve, or ibuprofen, which is the Advil, the Motrins, to help lower the fever, help you make you feel comfortable during your bout with COVID. It's not a cure, and it doesn't treat the virus itself, but it will make you comfortable. You may also hear of people trying to do immune boosting supplements such as vitamin D. We get vitamin D naturally through food and through the sun, but many of us don't get that in our diet. So there are some people who will take those supplements in order to keep their immune system up and help fight off those COVID symptoms. Also maintaining a healthy lifestyle, along with minimizing close contact with others outside your bubble and wearing that mask in public. Clean and disinfect frequent touched surfaces and washing your hands over and over again for 20 seconds. I was getting ready to say 20 minutes, but it's 20 seconds. You don't have to go 20 minutes. That's a little bit too long. So I will have some more questions. I will take questions about the treatment if you have any more.
There was one question that came in, not specific about the treatment, but the question is, where can people find information about testing? And does the insurance cover testing? So anyone on the panel can answer that question.
I can answer that, Sorrow Mary. I think the testing is free, and it's on Water Street in Waukegan, in Waukegan. It's on Water Street. And you just go there and you fill out some papers and they test you, and then they send the test back, and anybody can get tested. They don't have to have had COVID to get tested. They can just get tested.
Okay, thank you so much. That was the only site that I was aware of at the present time for this local area. But I do believe there are more testing sites.
Well, you know, the Jewels at CVS at Jewels in Waukegan on Granville Avenue, they had testing, and they said testing was $149, but they didn't have any more kits to test. And they were sending everybody to Water Street. And it doesn't take long at Water Street either. You're there about an hour, standing in that long line or in your car in that long line. It's only about an hour.
Okay, thank you so much, Carol. We're going to move on now, and we're going to hear from Brenda Wood, BSN RN. Brenda is a case manager director. She's a graduate of CLC ADN program and Purdue University for her BSN program. Brenda has been a nurse for 7 years. She has advanced quickly, beginning as a telemetry nurse, then assistant manager for telemetry and med-surg, then moved into nurse manager for medical surgical unit and to case management director. Brenda is the current president of the Chi Eta Phi Nursing Sorority Nu Phi chapter. Brenda?
Hello, everyone. Thank you for joining. Thank you, Mary, for the introduction. I want to let you guys know, I know there's a lot of myths out there that COVID's not real and all that sort of stuff, but it is real. And for those of you that may not have a response to people that say that, I mean, ask them, how many people have they buried? You know, how many loved ones have they taken to the hospital and they've never seen again? How many code blues have they done? How many people have they intubated? How many families have they had to talk to deliver them the news that the prognosis was poor and that their loved one was going to pass away? I can tell you that it's a little bit different this time around for us in the hospital, because literally the first time around, we probably had 60% of the Lake County population. So what that means is that this time around, yes, there's a lot of people, but you've only got 40% of the population. So that's a help for us, because that means that our ICU is not overcrowded as it was the first time around. Literally, we were 30 beds for our ICU. Normally we run 20. So we had a whole lot of overflow. So it's much better this time around with regards to supplies and that sort of stuff, but it has a different twist to it, a different feel. We're seeing people die every day. We're not putting people on vents as much because that's not the recommendation anymore. But the people that have been going on vents, they have been dying. And that's pretty much what the studies say, is that 60% of people that go on the vent don't make it off the vent. It's hitting us hard from the front line, because we're starting to see our peers, people that we work side by side with, and they're being intubated. So we're praying religiously, that these people will come off the vent and that they will be in that percentage that makes it. But the longer they stay on the vent, the grimmer the prognosis is for them to get off of the vent. A lot of things that we've noticed is that people wait too long. A lot of times people are in denial. It's okay if you think that you have COVID to go get tested. Do you have to go every single week? Do you need to go every single day? No, that's probably too much. But you do need to get tested, even if you think that you have COVID. Stay away from people. People feel that they're in a bubble. My niece, I call her, my best friend's daughter, she considers her bubble to be safe, but she doesn't know where those people in that bubble are going. She doesn't track them. She doesn't stay with them. So those bubbles that you think are safe turn out to not be so safe. We've noticed that a lot of people who get it from their inner circle, the family, the friends who they've considered to be safe. So nobody is safe. We should treat everybody as if they have COVID, because you do not know, and even people that have had COVID, they're still not safe. We have had a couple of people that have come in and said that they've had COVID before. So they've gotten it a second time. So you're not safe just because you have it. And I know the younger generation considers themselves to be invincible and it's not going to happen to me. We are seeing 30-year-olds come in with COVID. We're seeing 40-year-olds come in with COVID. It's not just the elderly. This time it's a younger population that's being affected by COVID. And it's very disheartening that you see these people come in and they're doing fine. They're talking just like you and I are talking right now. And then in a matter of seconds, literally, that person can be struggling to breathe. And next thing you know, you're putting a tube down their throat. And that person squeezing your hand, whispering to you, please don't let me die. That's a horrible feeling. So coming from the front line and having the difficulty of actually discharging people from the hospital, because in case management, that's what we do, we need everybody to do their part. Wear your mask. Nobody is safe because sorry, this hits home for me, because it's difficult talking to a family and telling them that their loved one is doing good, and then have to call them back and say that, no, I'm sorry, your dad was doing good yesterday. Today he's gone backwards. And the fact that it happens so quickly is what's shocking. I literally talked to a patient, say today, and reported to his daughter he's doing well. Come back the next day, he's confused. So confusion is real. He's confused, doesn't know what's going on. oxygen is higher than it was before. He's needing more oxygen. And this is a gentleman that was ready to be discharged to go to a facility for some rehab. Unfortunately, this gentleman did not make it. So please be safe, do your part. And if you value your life, show it. Wear your mask, clean your hands, do what's necessary. And I don't want to keep going on about it, so I will stop because I could go on and on and on about what to do for COVID. So if there are any questions, let's see. No, you can't say that severe conditions are isolated to people with pre-existing conditions, because if that was the case, you wouldn't have the healthy people that are dying from it. So not everybody that dies from COVID has had pre-existing conditions. Does that make you more vulnerable because you do have pre-existing conditions? Yes, it does. But that's with anything. Anybody that has pre-existing conditions, when they take sick, they're at greater risk for dying. So it has nothing to do necessarily with COVID per se. Pre-existing conditions hurt you in any type of illness. Any other questions? No? Okay.
Well, thank you, Brenda, for that very pointed information. It's really a reality check, because I know it's heard in the media how severe this virus is, the numbers of individuals that are dying from this virus, but somehow that kind of glosses over. People don't really internalize it and make it personal. But when you're on the line and you see that day to day, it gets very personal. And I could just hear it in your voice to just to try to get the people to recognize the seriousness of it and to recognize that they do have some control over it. Because taking the basic precautions, isolating themselves, and then making sure of the hand washing, and if you must go out, to just make sure that you're keeping that 6-foot distance. But the best thing is mostly it's just pretty much, if you just don't have to go out, isolate yourself and stay in, because it's a pretty grim picture for many. So thank you so much for that. Are there any other questions, or does the panel have anything they'd like to interject at this time?
Not at this time, Mary. I would take up the whole hour that we have talking about COVID. So let's keep moving.
Oh, okay, thank you. So we will move on now to hear from Sonia Cooks. She's going to give us what's happening in the academic setting and in the preparation of nursing students. Sonia is an MSN, RN, CNE, Certified Nurse Educator, and a Doctor of Nursing Practice candidate. Sonia has been a nurse for over 20 years, working in various clinical practice environments, and have spent the past 11 years working as a full-time nursing faculty at the Gateway College. As a nurse educator, Sonia's role primarily consists of working with the 4th semester senior nursing students. In addition, Sonia is a human patient simulation facilitator. In this role, she guides, instructs, and supports students towards achieving concrete learning objectives. Using this platform for clinical instruction has become a valuable resource, as students have been limited in obtaining direct patient contact. Sonia?
Thank you. Thank you, Sorrel Mary, for that introduction. And thank you for allowing me to be part of this panel discussion. I think it's so important to, recognize how academic preparation and training of our students has changed during this pandemic era. I also want to say I'm glad Sorrel Carol is doing better. I mean, she's so precious to us in many ways, and she obviously represents a vulnerable population. And just, you know, being able to present her lived experience and you know what she did, the steps she took to stay safe, and yet she was still, you know, contracted COVID. And also, Sora, Brenda, thank you for you know, giving us some insight into the frontline workers, what they're going through right now. You know, you described their challenges, some of the stressors, and, you know, just some of the things that they're experiencing. And so I also want to like celebrate some of the things that I know that the frontline workers are doing too. This pandemic has caused them to be very creative and very innovative, coming up with things that, you know, being creative in terms of the space, you know, space allocation, thinking of staffing models, supplies. Some of the nurses have been behind some of the new PPE innovations. So there's a lot of wonderful things that have come out of that. You talked about, you know, being with patients at, you know, time of death when family can't be around. There's been nurses who've been instrumental in, you know, making sure video conferencing has been available, you know, using social media and things of that nature. So nurses have been, you know, put in some pretty unique situations as a result of COVID. And so I'm here, as Mary said, to represent the future of the frontline nursing healthcare workers. So as she said, I work at Gateway Technical College, which is a community college. It's an associate degree program. We have approximately 420 nursing students in our program. And I'll say around March 2020, you know, when our program and many others, you know, dealt with the effects of COVID, our clinical partners, one by one, began to cancel students from attending clinical sites. Initially, it was because of fear of the unknown, you know, and then it was due to infection rates and conservation of limited personal protective equipment supplies. And so as a result, and somewhat overnight, we had to turn to alternative means of educating the students, both didactic and clinical hands-on experience. So we reverted to remote learning, which is online learning in a sense, but it's not as crisp as online learning. So a lot of the things that we were doing naturally face-to-face, we had to take it in a distant learning format. In terms of replacing the hand direct patient contact, we did virtual simulation, things like that. And then as the positivity rates began to lessen in the fall, some of the courses were held using a hybrid format, which means following the CDC guidelines, we only had limited capacity face-to-face, and then the other would be via remote learning, and most of it was Zoom. And then we utilized our human patient simulation to augment the direct patient care experiences. So a lot of people may not be aware of what human patient simulator is. It's referred to as, or simulation, I should say, is referred to as HPS. That's a common term. And it's pretty much the state-of-the-art mannequins that are equipped with realistic physiological functions that closely resemble human functions. So HBS interfaces with a computer monitor. And so the students are able to see parameters on the screen that mimic, like I said, natural physiological function. So they can see blood pressure, heart rates. You know, the mannequins are equipped with, you know, breath sounds, you know, anatomically correct anatomy and things of that nature. So it really does mimic the, you know, the actual human patient experience. These mannequins can come in different forms. You have high fidelity, so that is more of the state of the art, where again, you really wouldn't know the difference between that and a human. And it actually, the computers can generate conversation, so it's very lifelike. And then there's lower fidelity, where maybe if you just want to practice a specific skill, you know, how to draw blood, how to insert an IV, things of that nature, we can, or listen to breath sounds, we can get just that particular anatomical body part. So the students, we relied on HBS to augment our hands-on portion of the program quite a bit. And I'm fortunate at our college, we have a simulation center. So we do have adults, male, female, OB, pediatric, infant simulators. We have all those type of things. So we were able to give our students a pretty well-rounded experience. We also have what we call standardized patients. So we would role play. So it may be a faculty or another simulation facilitator could role play, the physician or any other interdisciplinary care team member. So that obviously aided to the realism of some of those scenarios that the students were exposed to. So again, simulation can, as a facilitator, based on what the objectives are for those students, I can create that experience for students. So, if it's about, heart attacks, the care for a patient who has a heart attack, or in the situation, patients who have respiratory distress syndrome related to COVID, we can create scenarios where students are placed in those situations and they have to use, the nursing process and make sure they prioritize their care and deliver specific interventions to help those patients. So those are just a few things. We also, because everything is electronic in healthcare, we have some programs that mimic the electronic health records. So students are able to come in and use computers on wheels to use the scanning to scan the patient's medical records, to look at their health history, to make sure that they safely administer medications and things of that nature. So that has been quite a blessing for us. I know just being involved in a lot of groups around the world that not everybody is as fortunate as we are in terms of being able to deliver that to our students. So I'm grateful for that. And so we are slowly returning back to our clinical organizations. And it's not been straightforward. It's not been easy transition. The students have to have weekly testing or screenings depending on the organizations that they are returning to. As far as the classroom, that hasn't changed. We're still doing the hybrid learning, but we need to get our students, as Brenda indicated, they're burnt out. They need, they need new frontline workers to help support them and replace them. And so that's kind of what we're doing. So I can tell you for the most part, our students are eager. We actually will graduate 40 of them tomorrow. It's their pinning, and they're ready to step into this workforce. They know what the expectations are. Yes, there's some anxiety there. Are we providing, mental health counseling for them? Absolutely. They're still, parents. They're still, citizens. They have a voice. They still have fears. But in terms of, supporting the future of the healthcare workers and what we need to do to combat this COVID-19 virus, our students are, I think we're doing what's best for them. They're accepting the challenge and they're ready to help augment, the workforce. So anybody have any questions for me?
There is one there specifically that you can take, Sonia, that's in the, if you can.
The mannequins are outstanding, but do students feel prepared once they complete the program? So absolutely. I mean, like I said, there's some anxiety with it, and a mannequin cannot replace that, human interaction. And there's no doubt we try to limit it because we are bound by our accrediting bodies that the students can only have, so many hours of patient simulation experience. But at the same time, if we can't get back in these organizations, we have to do what's best for the students. So absolutely. It's better than nothing, I tell you that, right? So like I said, we can be very creative in some of the simulations that we create for the students, so we can make it as realistic as possible. We tell the students to suspend reality. When they are working with a simulator, they are to treat it as if they're working with a patient. So if they're going to make a mistake, that's the area to make the mistake, right? In simulation with the mannequin. So yes, I think it's been, a very good useful product, I should say, that helps our students. And so we're very fortunate that we have really good mannequins, that our college has bought into the importance of having, you know, these simulations. And we're actually going to be expanding, and I look forward to having a, you know, even more state-of-the-art simulation center.
Okay, thank you very much, Sonia. Just to go back, the question previously about testing sites. So the one way that individuals can find out about testing sites, because there are various different other testing sites that pop up. So if they dial 211, it's a very informative line, and they can get all of the information that they need about the location of various testing sites, and they can be informed of testing sites that do not require any insurance also. I did just want to go back and share that. Okay, they want a little bit more information about the vaccine. That's what's coming through in the chat now. So
more information
about the vaccine. What? Is there any?
What do they want to know about the vaccine? If it's here?
Well, let's start by safety of it. Do you think, I mean, there's a lot of concern about it. And I have to say, especially in the African-American community, based upon historical occurrences, that that particular population is a little bit more reluctant about going forward getting a vaccine. So what could we share that would help reduce some of that concern? And I think the first thing is we do need to legitimize the concern and to be able to emphasize with those that have those concerns. But at the same time, a key component is education. So we need to continue to get the message out to and educate the individuals. We need to have them to take pause for a moment and to just look at the circumstances around them right now and what they're experiencing, that a risk is being taken every day without the vaccine. That each of us, as we go and come and have exposure, there is a risk that we are accepting. So education on the fact that the vaccines have gone through very diligent testing. It's getting the approvals that are needed. Recently, I listened to a presentation in which Dr. Fauci was the presenter, and he was stating that there have been over 30,000 people have participated in the Madura study, and there have been 44,000 individuals that have participated in the Pfizer study. So with that volume of individuals having participated, and they have gotten the green light to go forward with this, we at some point are going to have to relax the history and to listen to science. And the real point of that is that, yes, there have been some negative situations that have occurred historically. But if we're not careful, we ourselves are going to write another negative history if we don't open ourselves to be educated on the ways that we can prevent this particular virus from continuing to be so devastating amongst the African-American population. So I would say education is the key to really review and get as much information as you can to be able to make informed decisions. So I think, Brenda, you were going to share something on the vaccine also before I got on.
No, well, I mean, you know, of course, you have to follow the science with when you're talking about, you know, the vaccine and the data and that sort of stuff, because that's medicine. Period. It's all about the data, the trials, and that sort of stuff. So it's going to be a personal choice for everyone to do it. I mean, you have people that don't take the flu vaccine. You have people that don't immunize their children. You know, it is a personal choice. But at the end of the day, it could be a matter of life or death. I don't have data to justify whether or not the thousands of people that die from the flu annually are people that don't get vaccinated. But ultimately, it can be a matter of life and death when it comes to whether or not you take the vaccine. Will it save your life? Potentially. Doesn't mean that you won't get COVID. A virus is a virus. So just like the flu, you can get the flu shot and you can still get the flu. Usually medicine is done so that it makes the symptoms maybe not so worse. Or bad, I should say. But that doesn't mean that you're not going to have bad symptoms either. And like you said, Mary, every day that we wake up, you know, we're taking the chance. You know, we can walk across the street, get hit by a car. So at some point, we just have to decide whether or not, you know, it's for us and if we're going to do it. If we look at the data and we say, okay, I'm comfortable with it, then you go ahead and you do it. If you're not, then you don't. You should not. Don't be forced, you know, into doing it. Make sure that it's something that you want to do with regards to taking it. It's with regards to African Americans in history. We just have an issue with physicians, period, medicine, period. And it keeps moving forward, you know, each generation, because the generation before them had skepticism with regards to medicine. And medicine is a practice. That's why they call it the practice of medicine. It's not a cure-all. And I think that's probably the misperception, is that it's always trial and error. When you go to the doctor is really, truly, you know, assessing you to see what he thinks is wrong, because there's many things that your symptoms could be, you know. So we just continue to be mindful, watch to see what the studies show, and make that decision ourselves. But we do have to do away with that physicians are bad and not going to the doctor to seek treatment, because that's why a lot of the people that wound up in our ICU because they delayed coming in to get care. They knew that they had symptoms, but they were in denial, you know, so they didn't seek treatment soon enough. And so they wound up in a bad way. Doesn't mean that it wasn't going to happen, you know, if they had come in earlier, but they would have had a better chance if they had come in much sooner. Where can people find out more information about the COVID-19 vaccine? You can try the Lake County Health Department website, because the vaccine is coming to Lake County. If it hasn't been delivered already, doses of it will be here. So I would check their website for more information related to the vaccine. You could look at places like CDC, the Illinois Department of Public Health. Those are always good resources when there's something going on in the community with regards to, I should say, in the state with regards to illness. The Illinois Department of Public Health is a good resource. In any county that you live in, not just Lake, seek your county health departments for information related to health. I don't know if there was any other questions.
Well, I don't see any more questions, but I also want to say that we have to trust and believe that, you know, the FDA has you know, helped conduct clinical trials, and they have found that, you know, the benefits of this vaccine outweighs the potential risk of getting COVID.
Right.
So we have to, you know, we have to trust that the FDA is looking out for all best interests, and not, you know, and this is not the clinical trials. It was just, you know, on the African American community. This is, you know, everybody. So so we have to believe that the benefits of this vaccine does outweigh the potential of getting COVID, and then also stopping the spread of COVID. So
and that exactly correct, Marjorie, because medicine in general, you know, any pill that you take for any type of problem that you have, it's been through the same thing, you know, and there's side effects to anything that you take, you know. So you're right. When they put something out, they put it out because the good outweighs the bad. And that's what you have to look at. And there's going to be side effects to anything that you take. There's nothing that's side effect free. So.
Right. And I mean, we know that with the UK, when they just rolled out their vaccination program, they did have out of the numerous vaccines that they provided, it was reported only 2 had a negative reaction to the vaccine. So when you think about the numbers of the numbers, again, you got to think about, you know, they would never put out anything that is going to harm a large group of people. So
right. Right. That ultimately is the goal, that you do the most good for all.
Good for
yeah. Are you encouraging people to take the vaccine? Me personally, no. I am not encouraging anybody to take the vaccine. I'm just saying make an informed decision.
And I agree.
And that's really what it has to be. It has to be an informed decision, and keyword informed, because a lot of people make decisions and they don't do the research themselves. So with anything, seek it for, you know, for yourself. Do your own homework, do your own research. Don't do it because, you know, your next door neighbor went and got it, you know, and said, oh, you should get it because it's okay. You know, no, do your own. You know, investigate, ask your own questions. If you have a primary care physician, reach out to your primary care physician. You know, if you go to the Lake County Health Department, reach out to them. Use their website, use the CDC, FDA. There's plenty of avenues that you can utilize. And with regards to, do you think it's safe? Each person is going to have a different reaction to anything that they get, whether they're ingesting a pill, whether they're taking an injection. Everybody is made differently. So everybody's going to respond differently. That's not something that you see outwardly, because it's a chemistry that's within our body. So how we respond with our antibodies and a reaction to it, it's an invisible reaction that nobody will see. So it's a chance that everybody takes with anything that they do when you're talking about medicine, period. I mean, we've seen people take blood pressure pills, and then all of a sudden now they have a reaction to blood pressure pills that they've been taking, you know, for years. So it's going to be your choice. Just make an informed decision, because I don't want anybody saying, well, she said to go take that COVID shot. No, that is not what I'm saying. And I'm not saying that it's 100% safe. Just everybody will have a different response to it. No different than the flu shot. Some people get the flu shot and they swear that the flu shot gave them the flu. So I don't know if there's truth to that or not. That person could have already had some ailments beforehand that they didn't know that was going on. And yes, they did wind up with the flu. Do not know. I cannot validate that.
So I really think that vaccination is important. It's an important tool to help stop the spread of the pandemic. But again, now we have to do our parts with the wearing the mask, social distancing, and then all those other measures that we talked about earlier. So the vaccine is just a tool.
It's also
stay home. That'll help.
Staying home.
It's also important for people to know that they shouldn't have any ailments and take the vaccine at the same time, they should be totally well. No colds, no sore throat, no weakness or no anything. And they should be well when they take that vaccine.
That's a very good point, Carol, because a lot of people don't realize if they have or they're feeling kind of sick, not to get the flu shot. Right. You know, they still go ahead and they get the flu shot. Yeah, but you should not have any symptoms. And sometimes when you go to get a shot, they fail to ask you that question. So that's a very good point to make, that you don't want to have any sickness or feel sick when you go to get an injection of that magnitude.
Well, one of the questions on the vaccination information sheet that you have to do a questionnaire, it does ask, are you feeling sick today? And if you are sick, we will, you know, we will not administer any vaccine if you're sick. And that is, I work in a primary care setting. And so vaccination is one of the things that we do in our clinic. We don't have the COVID vaccine yet in our clinic, but we have all other vaccinations in our clinic, which are all recommendations. They're all recommendation. And again, it's your personal choice whether you're going to get vaccinated from, whether it's COVID or whether it's HPV or whatever vaccine that you're gonna get. But that is part of the questionnaire when administering vaccines. Are you sick today?
Okay, thank you so much, panel. That was very enlightening information. I do just want to kind of leave with one thought, and that was also presented by Dr. Fauci on the webinar that I listened to recently. And I really encourage individuals to look up this particular site to listen to the presentation that he did, because many of the questions that have come in this evening were covered in depth by Dr. Fauci. And he is notable, very knowledgeable in the field of infectious disease. But the point that was made at the end of his presentation was that it's going to take about 75% of the total population to be vaccinated in order to put this COVID to rest. So it is important to be informed, to seek out information, and recognize in our decisions that we're making, we do need to look for the greater good for the total population, because as some may get the vaccination and some choose not to get the vaccination, we all still remain at risk if we don't get the sufficient volume of individuals vaccinated in order to put this COVID-19 to rest. So again, I want to thank the panel, Chi Eta Phi nurses, for all of the enlightenment that you have shared tonight, and thank AACPG for allowing us to spend this time and offer this presentation to the public. And I'd like to ask that you consider next Wednesday on the 16th, the AACPG will be offering part 3 of the Eat Well, Live Well. So please try to join AACPG for that presentation. So at this time, we're going to say thank you again to all, and to have a good, safe night. Remember your precautions, wash your hands frequently, wear your mask, and watch your distance. Have a good night, all. Thank you for demonstrating the proper way of wearing the mask, Marjorie. Nose and mouth covered. Thank you.
Night.